Good morning, everybody. I hope you can all hear and see me okay. My name is Abigail Changer and I'm the Careers Information and Quality Lead for the Health Careers Service, the NHS in England. And what I want to do over the next 20 minutes, half an hour, is to give you, as Daisy said, an overview of health careers, because as my session is titled, you'll see from my slides in a minute, it's not just doctors and nurses in the NHS, and there is a massive range of roles and a range of routes in. So we're going to go through some slides, and then please fire in your questions in the chat box, and I'll try and get through as many of those as possible towards the end of the session. Okay, so I am going to share my screen now. Hopefully all of that will work, and then we'll get going with the presentation. Okay, so hopefully someone will let me know if there are any problems with seeing my screen, but I will carry on. If someone could just stick in the chat box whether they can see my presentation, that would be really helpful. And then I will get going. Excellent. Thank you, everybody. Okay, so yeah, health careers, that's just doctors and nurses, right? I think a lot of people, partly because of the media, do tend to think that it is all about the doctors and nurses, and certainly, you know, we've seen during COVID a lot of focus on the doctors and nurses. But as you may already know, and I'm about to tell you a bit more, you'll see that, you know, there really is a lot more to it than that. And one of the things that I really want you to go away from this session with, and I know you'll all be at various stages, some of you will have made up your mind already about what you want to do. Some of you might have come along to this hoping for a little bit of inspiration. So there are about 350 different job roles in the NHS, so there really is a huge range, and there will be many, you know, I wouldn't be able to list them all. There are so many, some of them patient-facing, very much that hands-on care, and others much more behind the scenes, but just as important to making up that team. And as I go through the presentation as well, hopefully I'll be busting some of the myths. You don't have to have a degree to work in the NHS. Some roles you do, you know, to be a doctor, you have to have a degree. To be a nurse, you do have to have a degree, although you can do that via an apprenticeship route now as well. But there are, you know, the roles where you don't have to have a degree, and also where you don't have to be involved in directly caring for patients if that's not what you want to do. Okay, so a little bit of background and context, and then some of the careers that are available. Then we'll talk about some of the routes in, and I'll show you some of the resources from Health Careers, which some of you might be familiar with already, but they might be new to others of you. And then we'll have a quick look at NHS jobs as well. And then, as I say, hopefully some questions. Okay, so one of the first things to say is that the NHS is a huge and complicated organisation, and actually over 1,000 organisations deliver NHS care in England. And that can make it really difficult for you as young people when you are hoping to access things like work experience, or when you're looking for vacancies or for training opportunities. It can be really, really tricky, because each organisation will have its own setup in terms of work experience. Some will offer a really good range of work experience, and others, for others, it might be, you know, less opportunity there. And in terms of, you know, school and colleges and the sorts of interaction that you may have had from local NHS trusts and things, some of you might have had quite a bit, and others not so much. And unfortunately, you know, that's the way it is. It is not necessarily consistent across the country. I can just see in the chat there that someone's having problems with a frozen image. Hopefully that's not a connection issue on my side, but please let me know if other people are experiencing that, but I shall carry on for now. Okay, so that those of you who like facts and figures, so the NHS is actually the 5th biggest employer in the world. When you add in the NHS staff from Northern Ireland, Scotland and Wales as well to England, there are about 1.7 million people working for the NHS. I've worked for the NHS for a long time, so I'm actually a nurse by background, started my training in 1992 and have worked for the NHS ever since, in a clinical nursing role to begin with for 10 or so years, and then in several other roles since then. And for me, I've got a huge sense of pride working for the NHS. It's a real privilege. And I think, I've no doubt through many of the sessions today, you'll hear a lot about, the impact that COVID's had and how, the NHS is really in the public's eye and is treasured. And that's a lovely feeling when you do work for the NHS. Okay, as we said, the media can sometimes really just focus on the largest staff groups. You can see why the nurses and doctors are the most obvious ones in many cases, but it's not necessarily helpful, particularly for when we're wanting to try and attract all sorts of people into the NHS and trying to highlight the many different roles that there are. Okay, so what sort of careers are there then? Now I know this might be quite small on your screens depending on what device you're watching this presentation on, but just to run through some of these then. So allied health professionals, so that's things like occupational therapists, speech and language therapists, podiatrists, prosthetists, orthoptists, physios. The list goes on. There are 14 altogether actually. Paramedic fall into those group, and also operating department practitioners. And I think there are various sessions throughout today on those professions, which would be worth you dipping into if you have the chance to. And they are very much about maintaining patients' well-being and encouraging people to live as full a life as possible within their capabilities. We've got the ambulance service team, and then obviously a range of roles in there, from the sort of the call handlers through to emergency medical technicians, associate ambulance practitioners, and all sorts of other roles. The dental team, again, not just dentists, but you've got dental nurses, hygienists, therapists, technicians, doctors with the 60+ specialties within medicine. Health informatics, which is a really growing area within health, because data is what so much of the world is about now, and it's no different in health. To provide high quality care, we need good data. Healthcare science then, so again, a massive range of specialties within healthcare science, of lots of routes in. Management, and I will mention briefly in a minute some graduate training opportunities for management. We've got medical associate professions, so things like physician associates, surgical care practitioners, midwifery then, and nursing, pharmacy, again, not just pharmacists, pharmacy technicians, pharmacy assistants as well. The psychological professions, so again, a really growing area within health. Psychological wellbeing practitioners, clinical psychologists, education mental health practitioners, many different roles. Public health as well, and I know again through COVID that's been an area, a specialty area that's really been highlighted, and we've really seen the importance of it. So again, range of roles in there, and you don't have to be a doctor to work in public health. And the wider healthcare team, so that draws in all sorts of things, so HR and estates management, and the clinical support roles. Unfortunately, we haven't got loads of time to go into any in great depth. This really is an overview, but I'll show you some more resources at the end. So for those of you who are asking for specific things, then I can signpost where you can find that information. Okay, so as I've already said, don't have to have a degree to work in health. So for some roles you do, but for others you don't. So, if you're sitting there thinking you're not quite sure what's going to be happening on results day next August, don't panic, because there are lots and lots of routes. And there is, no matter what happens, if you are one of those people in year 11 or 13 waiting nervously for next month, whatever the results are, and I hope they're good, but whatever they are, don't panic, because there is pretty much always a route through to where you want to get through, even if your initial results aren't quite what you wanted. Okay, so different ways to get in then. So there are an increasing number of apprenticeships in the NHS of all sorts of levels, some where you can go straight after GCSEs, and some that are much higher level apprenticeships. After a course at further education or college, so for example, you might be doing health and care course at college, which would lead on to something, or after A-levels or BTECs. after a full-time degree. So, for example, some of the healthcare science roles are graduate entry, so you would need a relevant science degree to enable you to move into that, or after a degree in medicine, for example, or nursing, or after experience gained outside the NHS, because you don't have to have worked in the NHS right from the word go. People can access the NHS from other sectors. Just to give you, for those of you interested in apprenticeships, and obviously I hope you all know, but the big advantage of apprenticeships is that you do earn a salary while you are undertaking your training. This slide, and I will read a few of them out, but not all of them. I've just seen here that someone's actually using their phone to watch, so it's all sorts of technology going on here, but it might be quite small print for some of you. So these are some of the apprenticeship vacancies that have been advertised in the NHS over the last 3 months. So these are very, very up to date. So we've got accounting technician apprenticeship, dental nurse, pharmacy technician, operating department practitioner. So that's a degree level apprenticeship. So exactly the same as if you're going to university to do a degree, but you don't have to pay for it, and you get a salary while you're doing that. Microbiology health science assistant, apprenticeship in radiation engineering, again a degree level apprenticeship there. Diagnostic radiographer, again another degree level apprenticeship. Apprentice clinical coder in Salisbury. I think someone in the chat box mentioned clinical coding earlier, so again that falls in the health informatics group, which is a really expanding group. And then apprentice assistant practitioner in robotic surgery, which sounds very exciting up in the Wirral there. So that's just to give you a little bit of a flavour of the range of apprenticeships that are available now. And you very much keep an eye on NHS jobs for apprenticeships. That's where they'll be advertised. Okay, so we'll talk a little bit more about that, hopefully in a few more slides' time. Okay, so degree level apprenticeships I mentioned. We're seeing an increasing number of these now. The one thing I will say though is that just because a degree level apprenticeship has been approved for delivery, it is down to the individual employers, so the NHS trusts, etc., to prioritise whether or not they do advertise those particular apprenticeships. So, for example, midwifery, there is now a degree level midwifery apprenticeship available. So instead of going to university, you apply for an apprenticeship with an employer and you undertake your midwifery degree while you are working and learning, and you're being paid a salary. However, I have not yet seen any external vacancies for people to apply to for midwifery apprenticeships, but they will come. So a lot of these that you can see here, so for those of you that are looking on very small screens, we've got paramedic, podiatrist, physio, nurse, speech and language therapist, occupational therapist, healthcare science practitioner, diagnostic radiographer. All of those have been approved as degree level apprenticeships. And some of them are advertising vacancies, but not all yet. So just keep looking on the NHS jobs website. This slide is just to give you, I've picked nursing just because it is one of the roles that has got a really good range of routes in. And it's just to give you an example of how there are so many different ways to get to exactly the same endpoint, just with different journeys on the way. And that really is one of the main messages I want you to take away from today, is that there are all these different routes. So we'll just very quickly look at these. Sanjit there on the left, 5 GCSEs at 4 to 9, including maths and English. And he's had a part-time job with students with learning disabilities and really, really enjoyed that. So then applies for the 2-year nursing associate apprenticeship, which is a level 5 apprenticeship, which is a foundation degree level. It's a 2-year apprenticeship. And that then would enable him to go on and do a shortened degree level nursing apprenticeship in learning disability nursing in order to become a fully registered nurse. So that's one route there. Helen's got 3 A levels, so biology, geography, chemistry, wants to be a children's nurse. This is the most traditional sort of route, if you like. And she applies for university and completes a 3-year degree in paediatric nursing at university to become a fully qualified registered nurse. Kamara has got a first degree in psychology, but is interested in mental health nursing. So she, because of her degree having some relevance, her first degree, she is able to do an accelerated nursing course, mental health nursing course, in order to become a fully qualified registered nurse. And then finally, Chantel, so GCSEs in Maths and English, and she works as a healthcare assistant, and then completes an 18-month apprenticeship as a senior healthcare support worker, and then is able to access the 4-year nursing degree level apprenticeship. So it's really just to give you a taste of the fact that there are so many different ways to do it, but it is often dependent on the local employers. Okay, so again, we're not going to spend ages on these slides. I'm very aware of time, and I know we started late, so hopefully I can go a little bit over 11, not 3:30. Don't worry, we're not going to be here that long. So just to give you some thoughts, if those of you who haven't yet decided or settled on what you want to do. So practice some of the things you can do with practical skills. I won't read them all out. We'll just pick a couple out. Clinical photographer, occupational therapist, prosthetist, IT support engineer, clinical scientist in respiratory and sleep sciences. If you want to work with children, then obviously, you know, you've got some of the obvious ones like children's nurse, school nurse, paediatrician, so a doctor who specialised in working with children. But then some of the others that you may not have heard of, so newborn hearing screener, or child psychotherapist, or music therapist, all that could work with children. If you're really into your science, and I'm sure a lot of you that have joined today very much are, so we've got things like phlebotomist, physician associate, pathologist, so again, one of the specialisms within medicine, health protection practitioner, dietitian, dental hygienist, so lots and lots of different things within science. Values-based recruitment, this is really, really important. So for those of you that are thinking you do want to go on and have a health career and are thinking in either applying for a university course or for a job or for an apprenticeship, then understanding these values from the NHS Constitution and being able to evidence how you demonstrate those values will be vital. It is just as important actually as your qualifications, because the NHS does something called values-based recruitment now to make sure that we've got the right people coming into the organisation who reflect the values that the NHS wants to uphold. Because it's all very well having 4 A stars at A-level, for example, but if you're unable to have a compassionate and empathetic and kind conversation with somebody, then healthcare is not for you. So have a look at these values. So working together for patients, respect and dignity, compassion, improving lives, everyone counts, and commitment to quality of care. And you need to prepare, either when you're writing your personal statement or preparing for an interview, be prepared to answer questions about these values. So you might be asked, for example, can you tell me about a time when you've shown respect and dignity? Or what does compassion mean to you? So start to build up evidence, a log of evidence, so that you've got those examples ready. And you can draw on those examples from all sorts of areas of your life, okay? So it doesn't just have to be from work experience, and we know that work experience is tricky, particularly at the moment with the COVID situation, but think about your home life, think about your school or college life. Have you had a Saturday job? Have you done some volunteering? Have you been able to have some work experience? What have you learned from all of that? Where have you demonstrated that you hold those values that I just showed you? So that bit is, I can't emphasize that enough, really, really important. Okay, so getting work experience, really tricky at the minute. So think very broadly. Okay, I know there are various organisations offering virtual work experience now, so look out for those, take advantage of those where possible. But the key thing, as I said, is to make sure that you are then jotting down what you're learning from those experiences so that you can use those in an interview or when you're writing a personal statement or supporting information for a job or a course application. Think about volunteering, because actually what you're really demonstrating when you're volunteering is that you're willing to commit your time on an ongoing basis to something. And as I said, use examples from all areas of your life. Okay, so the Health Careers website, I'm just going to have a quick sip of water. Excuse me. So the Health Careers website, some of you may have seen it already, some of you may not have done. This is the NHS's careers website for England, and there is a lot of information on there that will help you find out more about some of the different roles, and also there are some tools on there which will help sort of match you to some roles that might fit your interests. So you can use the site without having an account with it, but you can register for an account and log on, and that will give you some more personalised content, and it will also mean that you'll receive emails from us, from the Health Careers team, with some targeted information for you. It's not a huge number of emails, don't worry, so please do consider registering for an account with Health Careers. You can share pages through social media. You can see the tabs across the top there. So there are some mega menus that open up when you hover over those tabs at the top. Explore roles is the one that really sets out the detail about some of the different roles we've just briefly touched on today. So I can see various things coming up in the chat box about occupational therapy, clinical coding, dietetics. Have a look at the Explore roles pages because there's lots of information on there. Career planning, and there's a specific page on nursing careers there. And then there are a series of videos, news pages, resources, and then an events calendar. Okay, so what we've got on the Health Careers website is information on over 250 of the roles in health. And the details under each role page are things like what the working life is like. Sometimes there's a video of someone talking about a day in the life of. Entry requirements, training and pay, and further information. And you can actually compare up to 3 roles side by side on the Explore roles pages. So that can be helpful if you're kind of interested in 2 or 3 different things, then you can line them up and look at them side by side. The Find Your Health Career tool is really, really popular. So under the Find Your Career tab, that takes you to a tool where you answer a series of statements. And then once you've answered those statements, it will then bring up some suggested roles that match your interests and your skills. The first 50 statements you can do without an account. If you want to narrow it down even further, then basically what you will do is you need to register for an account then, and then you can log in and complete an additional set of statements, and that will give you an even more defined set of job roles. But the first 50 and the first batch of suggestions you don't have to have an account for. So I would really recommend, for those of you who aren't sure, or for any of you that think you've decided, have a look at the other options. Always good to have a plan B up your sleeve. The Course Finder tool is really useful as well. So the Course Finder only lists courses that lead to professional registration, but you can use that to filter down. And I'm sorry, I'm getting really aware of time now. I hope we're not going to get suddenly cut off because I do want to come back to some of the questions. And then we've got some literature, and that's available to download, and you'll find that under the resources section. But to be honest, if you're using the website, you'll find all the information on there. There's a Step into the NHS website. This is aimed at Key Stage 3 and 4. So it depends what age you are, but there are less roles covered on that website. And then the NHS Jobs website. So if you're looking for apprenticeships or jobs, this is the place to go, and you can register an account with NHS Jobs and then set up an email alert so that you receive emails when a job is advertised that fits your criteria. So really helpful to know that. So keep an eye on that website for, as I say, apprenticeships or jobs, entry-level jobs, and all sorts of other jobs. Okay, so you might want to screenshot this page. This has got a lot of useful resources on, so the Step into the NHS web address and the Health Careers website there, and the social media handles and things. So if you want to take a screenshot of that, please do. And I think then otherwise we'll go on to questions. I'll just put that back on there. So let me, if anyone's got any other last minute questions, please type them in now. So someone said, how useful would the information on the NHS website be for people in Australia? Are the process to enter medicine similar? I don't actually know the answer to that. I mean, certainly in terms of the sorts of qualities and skills that you need, that's going to be, that's going to be pretty much the same. But in terms of processes for entering medical school, I don't know. You'd need to get onto Google, I'd have thought, and have a look to see what you can find there. Is it essential to have biology A-level for podiatry? Right, so the thing about degree level courses is that they can really vary from university to university as to what the entry requirements are. So we always recommend to have a look at the university websites and see what the entry requirements are. So use the course finder tool, put in podiatry, and then that you will see that you can click through to the different universities that run podiatry courses and have a look at their entry requirements there. Okay, let me go, I'm just going to go back up to the beginning to see if there's anything I've missed from earlier on. Just having a quick whiz through here. So yes, clinical coding, Monica, you've asked that. So yeah, I'd go and have a look at the Explore Roles page to find out more about that. Just having a quick look through public health opportunities, Amelia. So again, have a look on the website and see. Unfortunately, we haven't got time to go into lots of detail now, and I don't know if there are any specific sessions on the rest of today about public health. Someone else has asked about public health as well. Dietetics and nutrition again. So Olive, have a look on the website and yeah, see what you can find there. Right, what else have we missed? Someone else, oh yes, so Monica, clinical coding, living in Birmingham. So yes, keep looking on NHS jobs, and the government Find Your Apprenticeship website as well. Occupational therapy, so a few people interested in that, and you know, you can work in a range of settings in occupational therapy, and there are apprenticeships, degree level apprenticeships coming on board for those now as well, so an alternative route, which is great. Okay, where are we up to? How important are A-levels to a degree compared to experience values? Really good question, Holly. Obviously, to get onto a degree course, you have to have the entry requirements that that particular education establishment is asking for, but experience and values are really, really important as well. So the two things really go hand in hand. There are occasions where people's experience will really might help sway things, but at the end of the day, always useful to have a conversation with the university if you can, and show them, you know, tell them what you've got and see what happens. But really, it's, you know, having those values and evidencing them is just as important as the qualifications you hold. And remember, there are equivalent qualifications, so it's not all about A-levels. There are the other level 3 qualifications that count. So where are we? Health protection practitioners. So if you have a look on the website, you'll find more about that. It's under the public health roles. And yes, as someone said here, lots of spaces for in clearing this year. The other thing very quickly to say, I hope I've got time to say this, is that there is some funding again this year for starting this year for people studying many of the healthcare courses at university. So there's a training grant of £5,000 for people studying nursing, midwifery, and most of the allied health profession courses. There's more information on our website if you go to have a look at that. And then there is another £1,000 a year if you're studying some of the shortage professions, which is learning disability nursing, mental health nursing, podiatry, prosthetics, orthoptics, and radiography. So that's another £1,000 a year. So it doesn't cover your tuition fees, but it goes some way to help support you. And there's also support towards travel expenses for placements and that kind of thing. And if you've got childcare responsibilities as well. So yeah, have a look about the financial support, but we're really pleased that from this September, the government's decided to reintroduce some funding to help towards maintenance and living costs for students studying healthcare courses at university. Okay, so someone's put financial support for GEM. What is GEM? I'm not familiar with that particular acronym, so if someone could just let me know what they mean, really helpful. And then I suspect we've got graduate entry medicine. So there is support for 2 years of the graduate entry medicine programme. So again, have a look on our website and you'll find all the details about that. I've run out of time.
Sorry.
Thank you so much for listening. And sorry about the hiccups at the beginning. I hope you found it useful.